Thanks, Tony. Well, when you think of holidays in June, your mind probably jumps to Juneteenth or Father's Day, but did you know that June is also Men's Health Awareness Month?
Yeah, joining us this morning here on Sunrise to help us put a spotlight on men's health is Dr. Deon Foster, who is a primary care physician for MUSC Health Primary Care in Blythewood. Dr. Foster, thank you so much for joining us for this important topic.
Hey, thank you so much for having me. Thank you both. It's a pleasure to be here.
Absolutely. So, Dr. Foster, we're going to jump right into it. Men's health, an important topic. I hope that this conversation, of course, will, just prompt some people to get checked out. But just talk about first why this month and significance of mental health and men's health is so important.
So, Men's Health Awareness Month is very important. A lot of the times, generally speaking, us men aren't as good as we should be about receiving healthcare services before a major health incident happens. So it's a fantastic opportunity to encourage men to get out there and take charge of our healthcare outcomes.
Yeah, sometimes we are afraid to maybe go see the doctor, but it's so important to go see him, to get checked up, make sure, your body's running right. Talk about some of the diseases that could be, could be felt here.
Yep. So, according to CDC data, the leading causes of death for men in the United States are heart disease and cancers of all sorts. And rounding out that top 10 list, it also features stroke, diabetes, as well as chronic lung disease such as COPD and emphysema. So a very long list of diseases that affect us here locally in our community.
Absolutely. And talking about, those trips to the doctor, what are just some things that you can do routinely to stay healthy?
It goes back to a lot of things that I'm sure most of us have heard about since we were young kids, which are diet and exercise. But also along with that also flies under the radar is sleep. From a nutritional standpoint, making sure that we're doing as best we can to lower our sodium intake, not putting too much table salt on our foods, watching out for how much sugar and carbohydrates we're taking into our diet. Things like that can keep us away from high blood pressure and decrease our risk for diabetes and pre-diabetes. Additionally, from an exercise standpoint, making sure that we're getting out here and getting a few steps in throughout the day, not necessarily trying to turn anyone into a pro athlete or a bodybuilder, but from a cardiovascular standpoint, just 15 minutes of walking about 3 times a week can go a long way to keep us away from heart attacks and strokes, and making sure that as best we can get at least 7 hours of sleep. It lowers our risk significantly for many of the chronic diseases that are out there.
Yeah, it's always important to maybe get your workout on early in the morning or maybe when you get off, just to make sure that your body is functioning properly. Talk about some of the priorities men should be paying attention to when we talk about mental health.
So mental health should be right up there with those diseases that I mentioned earlier, heart disease, cancers. And I'm seeing in my clinic a lot of men who are open to having conversations about mental health. I think we've come a long way as a society in terms of destigmatizing those sorts of topics. And a lot of times men, either internally or externally, feel the pressures of having to work a job and provide for a significant other or for children. And a lot of the times those stressors, if not properly processed, can manifest itself as things like depression or anxiety. And even men are getting better now at identifying past traumas for what they really are and taking the necessary steps towards addressing those symptoms. And if those symptoms go unaddressed, it can lead to other chronic diseases, like I mentioned earlier, heart disease, stroke, diabetes, things like that. So absolutely imperative that men are having these open conversations with their providers.
Absolutely. That open dialect is so important. Talk about, doctor, when you should go to the doctor as far as checkups, routine checkups for certain diseases. Just talk about when is the best time to go. Is there a certain age or should it just be routine?
So at least, generally speaking, at least once a year should be a routine time to go in and talk to your provider about routine care. Generally speaking, most men and adults in general should be getting screened for colorectal cancer starting at age 45 now, sometimes even earlier than that if there's a stronger family history involved. And there's a couple of different ways that we can screen for that. There are some at-home tests in addition to colonoscopies, which is the tried and true screening mechanism. But having a conversation with your primary provider can help point you in one direction or another to see what makes the most sense for you. Additionally, prostate cancer screening is very important. We now use a blood test primarily called the prostate specific antigen test, or PSA test, more commonly it's referred to as. It's just as simple as doing any old blood draw, and we should start doing that usually at about age 55 for most males. Males who who should be on the lookout for that as far as being higher risk are men with a first-degree relative, father, brother, or even son who've been diagnosed with prostate cancer, and men of African descent. Statistics show that African-American males have a higher likelihood of developing prostate cancer than males of other ethnic groups.
Some important information that you just provided for us. Dr. Foster, thank you so much for being here with us this morning. We're going to have all of this information on our website, WISTV.com. Again, go get checked out, man. From a man.
Yes, indeed.
Go get checked out.
Go get your mental, checked out. Go get your body checked out because it's important, doctor, right?
Yeah, absolutely. It's important. So come on by and see us or see your primary care provider, and they'll be sure to take care of you.
Absolutely. Thank you so much, Dr. Foster.
Hey, thank you both. I appreciate it.
All right. Stay with us. We got more Sunrise after this.